right, good afternoon, everyone. We are here for our Town of Norwood weekly COVID-19 update. We're going to go ahead and get started in just a minute as folks log on. Log on. We've got some information about our weekly COVID numbers and what we're doing and what's changed, as well as some other town updates. We did not do a recording last week due to the Thanksgiving holiday, so we do have information this week, and we'll continue bringing these weekly. We're not quite sure about the Christmas holiday schedule. Hey, Catherine, thank you for joining us today. And thank you for going out on Small Business Saturday, or Norwood Day, which we're going to talk about, and getting what looked like something delicious from Daddy's Dairy. Certainly thanks to everyone who went out on Small Business Saturday, which was our version of Norwood Day this year, and supported small businesses. So we are actually going to talk about that and some other ways we can support some of our small businesses throughout the holiday season, as well as into next year. And we will go through that in just a few minutes. So I want to welcome everyone. We're going to start off with our COVID numbers and a little bit of an update. Our numbers continue to slowly but surely increase, similar to what we're seeing around the rest of the state, although we've been doing better on average than the state the last couple of weeks. Our percent positive rate is up to 3.85%. For a while, we've been hovering around 3%, a little bit lower than the state. We did have a larger jump in one given week than we would have wanted to. John Tassel's was delicious on Saturday. I got a baklava wrap. It was incredible. I also was at the airport, which was great, so I'll have to let people know about that experience. So a 3.85% positivity rate is not great. We're not thrilled that it's there. It is going up. We have had about 100 folks in the last 2-week period positive tests, so our numbers are continuing to climb. Interestingly enough, we've hit about 1,000 people having tested positive in Norwood since the beginning of March, so that's about 1 out of every 30 residents in town. Our testing is slow over the last 2 weeks, although we believe that to be because of the combination of the holiday and a few other factors. We are still averaging about 200 tests per day for Norwood residents, which is actually a fairly good testing rate. About every 2 weeks we're doing a little over 3,000 tests, so that's down in the short term, but up historically over the long term. So it does seem like we're still managing a good number of tests. The testing trailer at Norwood Hospital, which the town partnered with the hospital on, is doing well. We're seeing a higher percentage, percent positive from the tests at the hospital's trailer. And we believe the reason that is that they are, you do require a doctor's note, so it's likely only folks who are symptomatic who are going there. You're not getting the travelers or sort of the general interest tests that are out there. So the testing results there are likely to have a much higher positivity rate, which is both good and bad. It's of course bad. We don't want a high positivity rate. It's good because it does show that at least that service is being utilized. The testing at Norwood Hospital at their trailer site is available with a doctor's note, so you do need to call your doctor and they fax over an order. Testing for anyone with health insurance is or should be free if it's with a doctor's order. There are occasionally charges depending on your insurance if you're trying to get tested for travel or for other reasons why you just sort of curiosity tests. That's kind of a catch-22 for both the state and us locally with testing, because we want all the testing out there in the world. We want the availability of testing. We always tell people get tested, get tested, get tested. However, it is causing a little bit of a clog in the system statewide. We're seeing the timeline for tests get clogged up a bit. I think officially the state's saying maybe 2 days is the test results. We're seeing it a little bit longer than that. One of the challenges is, you have universities that are doing a lot of rapid testing or a lot of sort of comprehensive testing, and the problem with that is the labs just can't keep up with that volume. So there's still a little bit of a lag there. Most people are getting results back in a couple of days. Test results can get lost in the mail, so to speak. That actually happened to me way back in March, where we had to have tests done. I had to have a test on a second time and had to get driven in directly to the state lab, which is actually an interesting story. Just as a brief aside, I got tested on a Friday night. I think the next day or the day after, they told us that the state somehow had lost the test results, and I had to go get tested again. I went and got tested again on a Sunday, and Bernie Cooper, Assistant General Manager, and Stacy Lane, our Assistant Health Director and Public Health Nurse, personally drove my test results from the hospital into the state lab to make sure those results would get back, back when things were a little bit crazy in the early March. So There usually is a test for. I did get a question again earlier in this week from somebody who said, "Can we make free testing happen in Norwood?" If you do have insurance, testing is free with a doctor's order. If you are getting charged, your insurance might differ a little bit. Let us know. We do have a small allowance available for uninsured testing, but it's very small, and that's just everyone in Massachusetts should have health insurance, except when people are in between possibly in between jobs. With testing. Lisa was just there at 3 o'clock, easy in and out. Hopefully your test comes back negative. I keep getting the wording wrong on that. I'm always like, well, hopefully your test is positive. And I'm like, no, I mean, I hope your test was good and that the test was negative. So hopefully it was negative. Everyone that's gone there has reported. It's pretty quick and easy in and out when they're doing it. I think the trailer to date has done about 800 or 900 tests so far. So we're glad we're able to partner with the hospital and bring that here. We, of course, do encourage people with symptoms to get tested. Give your doctor's office a call. The sooner we know, the better it is. You may have read some articles in the media about contact tracing starting to take a long time, and I think there may have been a Globe or a Herald article about, is it worth it? The state's invested a lot of money in their contact tracing collaborative. We use that in some cases. We do most of our own contact tracing in-house with our public health staff. We find it incredibly valuable and incredibly useful. The only challenge we ever find is when people aren't necessarily sort of that open about what they've done, and we're just trying to get the information as quickly as we can. When there's a lag in testing, it does create a little bit of an issue, but it's also sort of a cautious, hey, once you get that test result, the quicker we can sort of contact everyone who's a close contact, get them to just stay home for a few days, it then makes things a little bit easier. The CDC is always revising their testing guidelines, and we work with the Department of Health, I should say their quarantine guidelines, and we're generally following what their guidelines are. Remember that the CDC may release guidelines, and it will be some time before we immediately adopt them, or I should say we don't immediately adopt them, because we generally are going with what the state's Department of Public Health issues for guidance and make sure that we understand it. They're always sort of moving the quarantine time back and up. We do have it's interesting, I myself tested positive back in mid-March for COVID, or early March. I had been sick in February for a couple days. I had assumed that was when I ended up catching it. Really no way to know it, but I was out and about for a few weeks before that, and it was March 1st when we started seeing testing numbers. But the contact tracing helps. We ask everyone, if you do get that call from the contact tracers, to go ahead and answer the call, answer things truthfully. Maybe you did go out to for a couple of drinks with a few friends, or you went over somebody's house, and we know where we should all be trying to avoid that. It's okay. Just tell the contact tracers that, so that way we know. Folks who are able to stay home for a few extra days, I think that's when you can do that. That's an important thing. We, of course, always encourage everyone, stay home if you're not feeling well, wear your mask, be safe, and wash your hands. I think we haven't seen a lot of spread in the schools in most cities and towns, and certainly not in Norwood. And we've talked about that's due to a couple of things. One, they do have a hybrid model that's working. They have teachers and students who are committed to safety. They've really put together a good plan and are following safe protocols. But I also do want to give credit to a lot of parents who I think have been reasonably protective. In some cases, you might say overprotective, but in a good way, where kids maybe aren't feeling well, so they keep them home for a few days. The parents aren't feeling well, you keep the kids home for a few days. We think that that's what's helped, that's allowed us to keep our hybrid model going. We do know, like other districts, we will occasionally have a time where certain grades or certain schools may need to pivot remotely. I know the school committee has worked out their process for that, getting the advice from public health. And all that really means is there may be a time where we say, gee, there are a number of cases at a particular school. It's easier to just have them pivot to remote for a while on a school or a grade by grade basis, as opposed to sort of shutting everything down, turning everything on in the whole district. We do get questions about, when are schools going to be fully in person? The short answer is nobody knows for sure, but I'm confident that that date is getting closer and closer. It's certainly not next week or the week after, but we do know that a vaccine is coming. One of our challenges in Norwood in particular with putting more kids in the classroom is we have our neighborhood elementary schools, which they're great for sort of building a school culture and building neighborhood pride and really giving the kids a sense of place. They are old buildings. They are small buildings. Maintaining some distancing isn't the easiest thing to do in the buildings that we have. I know the state's always encouraging more in-person instruction. I think the minute it can be done safely, everyone's going to want to do it. But a vaccine is coming. We're expecting probably in 10 or 15 days the first of Pfizer's vaccine to start getting shipped out. The state's still finalizing the plan on how that's going to work, but the federal government and the state government have been working on that rollout. And it's important to know Moderna, for instance, has been producing upwards of 1 million doses a day since this summer. So there is sort of a lot of vaccine there ready to go once they get that final regulatory approval. And it's going to hit healthcare facilities first and residents of healthcare facilities, residents of nursing homes, hospital patients, hospital workers first. It's then going to roll out to first responders. Teachers are fairly early on in the process compared to if this was sort of just a general inoculation or some sort of a different program. So given the numbers that are being produced, I think you may see a lot of healthcare workers and maybe nursing home residents by the end of January fully inoculated. I could be wrong on that. And then as it starts rolling out, remember that in Norwood, if we had to inoculate every teacher and aide, there might be 500 people, so that's 1,000 doses. So with 1 million being produced a day just by Moderna, and I know Pfizer is producing quite a bit, and that's it's an indication that when you divide that out over the country, we're going to get to those numbers pretty quickly. Maybe we'll be back to normal, if there is such a thing, in the school system by April. Maybe it'll happen earlier, depending on how quickly the rollout and the vaccination goes. I'm by no means an expert on vaccines and their development or epidemiology. I do know some folks out there have expressed concern in general about, gee, these vaccines happen so quickly, and is it going to be safe? Certainly, I rely on the word of experts to say that they are. As soon as I have it available, I'm going to get the vaccine as soon as I'm able to. One of the things I think is important to remember is, as a country and as a world, as this problem developed, instantly so many resources went into producing and studying and coming up with a vaccine. And we don't really approach disease management that way with anything else. If you think of all of the different diseases that are out there and all the different research foundations and the research that goes on, it's all great work, but it's all going in different areas. And that's one of the reasons the pace of that research is so slow. But all of a sudden, an enormous amount of money has gone into researching a vaccine for COVID. And it wasn't just one company. I mean, sometimes you have maybe one company, you got a couple of labs or a couple of universities around doing it. You had the full sort of weight and resources of the United States, the European Union. I wouldn't trust a vaccine from Russia, sorry, or China necessarily, but you've had billions and billions of dollars in the full weight of corporate and academic and public research going into this. The approval process has been fast, but think of any approval process where maybe it normally takes you 5 days. When people start working double shifts and you put twice as many people on it, things can happen faster. It doesn't normally happen that way because our resources at the state, the local, and the federal level are all sort of spread out to do everything we do. The paperwork comes in, you review it, you go through the process. At the local level, if you were to, ignoring public notice requirements, if the planning board had to get a site plan approval done in 5 days, well, if the applicant had all their materials on Monday, maybe the planning board has an all-day Monday meeting, and then Tuesday you have your engineers there actually doing the plan review or the site review, whereas normally the process is, okay, they talk about it, they mail it out to an engineering firm for peer review, they put it in their workflow. It's been rushed, but the work has been condensed to a shorter period of time because so many resources are being put towards vaccine development. I mean, Moderna has effectively had their vaccine since, I think, March, and it's gone through the testing. I do know some people who have let me know that they were part of that initial 30,000 testing group of people who were tested, and they're doing fine, and they're healthy, and they're out there in the community. And as I said, as soon as the vaccine comes out, I'm going to be first in line as soon as town managers are allowed to get it. I don't know where I'll fall in on the list of folks being able to get it, but I'll be sure to bring those results to people when they're there, and I would encourage everyone as soon as it's available. I think it'll be important to get us back to normal and then moving on with the next phase of our life in our community. So, for all intents and purposes, those are our COVID updates. One more somewhat related COVID update. Somebody had asked me, and it's really a question for the superintendent, but I did get the answer. There have been stories in the news about lots of students not logging on to remote learning, and that they've sort of never been able to get them any logged in. And some towns are having 10 or 15%. The number in Norwood, or the percentage, is less than 1%. That is lower than sort of the truancy rate in any given year. So if you did the math, there's actually probably more kids learning this year than there is in a given year, which is kind of bizarre. A good thing, in a good way. So that rate for Norwood is less than 1%. We're also doing actual hybrid instruction or actual face-to-face instruction digitally. Many towns are not even doing that. Their sort of remote learning is they kind of meet with the teacher and then they're getting stuff for a couple days and doing none. Now it varies class by class and school by school a little bit, but what Norwood is doing is probably in the top 10% of school districts in the Commonwealth for our hybrid learning model, and more importantly, the remote learning that we're bringing to students. So I know it's not perfect. I encourage you with specific questions, please reach out to the superintendent or your school principal because it is beyond my area of expertise. But sort of taking a step back, we've invested the resources to ensure that what we're doing is far superior to 90% of the districts in the Commonwealth. We allocated about $600,000 at town meeting on top of a reallocation of around $1 million in the school budget to make this model work. So there are towns out there that did zero, absolutely nothing. That's on top of the fact that we've taken few, if no, resources from the school budget to deal with COVID expenses. We're using our CARES Act money. That number of what school-related costs are getting costed to COVID is somewhere in the tune of, the last I checked, it was around $400,000 this fiscal year. A quick example of that, I know between last fiscal year and this fiscal year, we did about $240,000 worth of Chromebook purchases last year. And we've done, we just authorized, I signed the PO last week for another $100,000 of our CARES Act money to go towards Chromebooks. So that money is not just being pulled from an academic program and then put towards something. $300,000 or $400,000 of PPE costs and everything else, that's all being costed to CARES Act money. The school department reallocated $1 million in costs that likely wouldn't get spent. Town meeting appropriated an additional $600,000. So we have sort of thrown all the resources necessary to make it work as good as it can. And the type of program that Norwood Public Schools is offering for their remote learning is in league with towns far, far wealthier and better resourced than us. And it's really a credit to the town support of education, to the school committee and Dr. Thompson and his administrative team and the teachers for saying we're going to do this right, and our goal is going to be how do we put together the best program to make this work, and not just how do we sort of get through and meet the minimum standards. We have put all those resources towards it, and they're doing it. Now we know that no amount of resources, no amount of money or funding or desire can ever replace in-person learning, but what you're going to see in Norwood versus a lot of other districts is at least kids are not going to fall behind, whereas some of these districts where they've done nothing, September, October, November, lost time. December, January, February will probably be lost time. That's not happening in the Norwood Public Schools. They, as Amanda said, they really are making lemonade out of onion juice. I've never heard that phrase before, but I think that accurately describes what they've been doing. And as I said, the students who they can't seem to find, the students who have never logged in at less than 1%, there are some cities and towns, and they're generally the gateway communities or communities that have a lot of socioeconomic challenges. I mean, they're seeing that several percentage points. Some of them are almost hitting double digits. And remember, Norwood is not a wealthy community. We're sort of solidly middle class. The wealth level in the community is increasing, but we are not as wealthy as our neighbors. And we are not as wealthy as the communities that are putting together the kinds of program that we are. And the numbers that we're seeing for the folks who have never logged in, we're blowing our comparable communities out of the water in terms of what we're doing. So kudos to NPS and the school committee and Dr. Thompson and everyone else who is the administrators and the teachers and the cafeteria workers and the janitors. And again, I point out every time the cafeteria workers who have worked every single day of this pandemic, as have the facilities team, school and town IT. The broadband division of Norwood Light has been providing free or low cost internet service to several dozen families. I know that the private companies have done that in other communities. There's been some challenges with it. In Norwood, we were able to just, boom, get it done. We didn't have to wait for grant funding. We didn't have to wait for an approval. It was, do you have the address? Boom, it's done. It was that quick and easy. Correction, it was that quick. It was not easy. A lot of people had to put a lot of work into it. So That's our COVID update. Turning on to a couple of other items. An important announcement about the Circle of Hope. Their Luminary Night is normally Friday, this coming Friday. Circle of Hope is a wonderful organization in town that provides a lot of necessary resources to a lot of people in need, particularly those people suffering from critical illnesses. Their Luminary Night was going to be this Friday. It has been moved. I believe, it was going to be this Saturday. It's been moved to this Sunday. We've posted it on our social media. We'll get it there in the comments. But Circle of Hope's Luminary Night has been moved. So if you're planning to go check it out, by all means, go ahead and just note that the date has changed. I believe we're expecting rain this weekend, unfortunately. Thanksgiving was last week. I want to give a particular shout out to Carrie McCarthy at the Senior Center and her staff, as well as a group of volunteers, Lombardo's out of Randolph, and Table Talk Pies and the Girl Scouts. We delivered this past Thursday 200 meals to seniors in Norwood. Normally Lombardo's does a free meal for seniors and anyone who could use it on Thanksgiving. They decided to move to a delivery model this year. We had more people sign up than they could accommodate. They could only accommodate about 150 meals, free of charge. So we actually had our in-house staff at the Senior Center prepare an additional 50 meals. We got pies donated by Table Talk Pies, and the Girl Scouts donated cards that went to the seniors, and a group of volunteers and staff met on Thanksgiving morning and delivered 200 Thanksgiving meals to seniors. So kudos to them for what they've done and getting those meals out to seniors completely free. We did have a storm this past weekend. Norwood Light did a great job, as well as MPD did. We had some sporadic outages. We never had a town-wide or a large outage, so we're grateful for that. As storms go, that one was relatively easy. A couple of trees down, a couple of small outages. The light department crews were largely in by about 2 a.m. and they had completed their work, which was great. So they did a good job on on that particular storm. I want to take a minute and anyone who's in a PTO out there, we've reached out to the parent-teacher organizations before. You can always email the manager's office at managers@norwoodma.gov if you're having any of your PTO promotions, and we'll get those out on the town social media page as well. In particular, the student council at Norwood High has their student council store up and running, and they've done it in sort of a couple of different chunks. We're going to get that link posted here in the comments in just a minute. We've shared it on our social media platforms as well, that the student council has a store. You can go on and get Mustang gear on there, and it all supports the student council. The last time they did this about a month ago, I did get this great hat from them. They've got a lot of new gear on there, and I just encourage people to check it out. Great Christmas shopping. And why do we promote these PTO events and the student council PTO? It's all money that goes back into the community and into our town and school organizations. So if you're able to, if you want to buy some items off there, by all means, go ahead and check out the Norwood High Student Council store. I believe orders need to be in by either December 14th or December 17th. So just check out those things. And again, if you're a member of one of these PTOs, by all means, for the school organizations, email us and let us know when you're doing these different promotions. A lot of times, I know there's, they'll do the charity fundraisers. You get dinner at a restaurant or something. Let us know. We like to send them around, and I like to send those around, especially for the PTOs, to town staff as well, to make sure people are aware that they're going on. So check out that Norwood High School Student Council store and get your orders in by the middle of December, and you can get some really great Mustang gear. This past Saturday was Small Business Saturday, and it was our version of Norwood Day this year. I want to thank everyone who went out, who posted pictures, who left reviews, who used the hashtags and got their Norwood Day buttons, which are good for Norwood Day 2021. Many restaurants and businesses will still have those available through the month of December. We want to encourage folks to shop local. I hit a lot of places. I got a frap from a baklava frap from Tasso's. I bought gift cards at the Mug and Muffin. I had shopped at a few other places. I still have a lot of local shopping to do. I haven't gotten all my Christmas list done. But we want to encourage everyone to shop safely, of course, but to shop local this winter. We know that the other side of this is in sight. The end of the pandemic is in sight. A vaccine's been approved. Moderna's version is going to get approved. They're going to be shipped within 10 or 15 days. It's going to take time for it to get to everyone, but the light is even more now shining through the clouds, and we can see the other end of this. The hump that we've got to get over between now and then is keeping the numbers at least where they are, or from not growing too much to not have any hospital overload. Hopefully reduce it just through our actions alone. But from a business perspective, we got to get some of these small businesses just through the next couple of months, and then things will start to normalize. For certain businesses, winter ends up being a tough time to begin with. People tend to go out less. I know I certainly do when it gets cold out there, but we've just got to get our small businesses through a couple more months, and then whatever the new normal is, we'll be here. That vaccine rollout is going to be faster than I think people are realizing. I mean, if you think of the first quarter of 2021, January, February, March, Moderna alone is probably going to produce upwards of 90 million doses, and you have Pfizer producing vaccines as well, vaccine doses as well. So you're going to see it start to get shipped out. You're going to start to see it go through the different portions of the different phases. Gotta love the state and federal government. It used to be phases 1 through 5. Now there's just 2 phases, but there's several steps to each phase. Maybe it just sounds better that everyone's in phase 1. It's just A, B, C, D, E. But you're going to see that start to happen, and that will start to see the numbers curtail. Things will be able to open up, but it's about getting these small businesses through this this coming winter. So buy local, shop local, eat local if you can. Buy gift cards. It's a great way if you're saying, gee, I don't really want to go out to eat tonight, or I don't really want to go do takeout, or eating at home. See if you can get a gift card to a local business. A lot of local businesses do merchandise. If you go and they're offering shirts or hats or something for sale, by all means, do that. We want to encourage everyone as much as we can to shop local. We do want you to do it safely. I know I did get a question last week about, gee, a lot of these stores that we have in town that are local, they're small stores or retail stores. How do you encourage people to go in them? But on the other hand, you're saying you need to be safe. Be safe when you're doing it. Don't go out if you're not feeling well. Wear your mask. And some stores will have, the smaller stores might say, hey, we can only have 4 people in at a time. Do you mind waiting a few minutes? And ask you to wait a few minutes. I think it's a reasonable sacrifice and a reasonable rationing to get us through with some of these stores. And local stores sometimes do ship online too, or do sell online, so that's always something you can look at. I know a lot of people use services like DoorDash and Uber Eats and to get food from local restaurants. Whatever works for you. A lot of restaurants have pivoted to doing more takeout, but we also do still encourage you to go out and do indoor dining in a safe manner, preferably with your household or not with too many people outside your household. Or if you're going out with people outside your household, try to mitigate it here or there and say, okay, well, I did have coffee with Bob on Monday, so Tuesday maybe I'll just not do anything, and then all right, well, maybe Wednesday I have coffee with Sally, and then try to give it a few days. I do that. I do see a lot of people. I do a lot of indoor dining. I try to mitigate when I'm doing it and reduce it where I can, or just know if I did happen to have lunch with some folks, calm it down for the next couple of days. Where we haven't seen any clusters related to indoor dining in Norwood whatsoever. One of the reasons the governor looked at shutting things down, I'll be quite honest, from our analysis, is problems in other communities, particularly in Boston, where large groups were gathering and they weren't really practicing good social distancing, they weren't really wearing masks, and people were lined up too close together, and they sort of took an approach statewide when they really, in our opinion, subject to obviously interpretation, and it's just an opinion, should have taken a targeted approach to those cities and towns that were having a problem where there wasn't a lot of enforcement going on. That being said, the governor's orders are the governor's orders. You can do it safely. If you go out with 5 friends, don't go out with 5 friends 5 nights in a row, because that tends to cause a lot of issues. And the more you can limit things while still supporting businesses, the better. We're pretty convinced that a lot of folks that I've talked to at least, had a much smaller Thanksgiving than they normally do. I did speak to one friend of mine who lives in Norwood who he said normally they have about 20 or 23 people. They cut it down to sort of 7, which was kind of the immediate family, and everyone checked in and made sure they were feeling well. Nobody had any colds. Some households kept it to, their 4 or 5, whereas normally they're having 8, 9, 10. I do know a lot of families, and we appreciate it, that quarantined ahead of time, that didn't go out for a while, that sort of said, let's all stay home for a couple days before Thanksgiving, and they stayed home 3, 4, 5 days before Thanksgiving and said, okay, we're going to get together, and then we're going to stay together or not go out too much for a couple days after that. I'm hopeful that even if there is a spike in numbers as a result of Thanksgiving, Norwood, by and large, did things well and did things safely, and we certainly appreciate that. So, shop small, shop local when you can, particularly thanks to the Neponset River Chamber and the Friends of Norwood Center for helping promote Norwood Day and shopping local this entire fall and throughout the holiday season. We appreciate it. Question we got on leaf pickup. Sometimes we miss leaf pickup. We used to contract out leaf pickup with Waste Management, and when they did it, they actually only would come sort of a few times a year, and that was it. And if it was missed, it was missed. Cost us several $100,000. We've been doing it in-house now for many years. COVID has made the process a little bit more difficult. We don't have the same number of people in the trucks. Takes more people, takes more manpower. We sometimes get behind on it. It's still, even when we get behind, a premium service compared to what most towns offer. You can always bring your stuff up to the dump. Recycling center. It's not a dump anymore, but we all call it the dump. We did expand hours for 2 weekends at the dump recycling center to try to accommodate additional leaf drop-off. It does get challenging sometimes when there's so much going on, and it is a big process to manage that enormous mulch pile, if you will, that we get from all the leaves and yard debris. But for the leaf pickup, you can always let the DPW know if you've put it out after a week and it hasn't come. We try to do the best we can. It is sort of a high level of service that's not always possible to get perfect every time. If we were to try to go back to contracting it out, you wouldn't get the same level of service. There's maybe a perception out there that it would be perfect and it would never be a problem. You'd probably occasionally have the same issues, and we'd have to come up with a couple $100,000. Really nowhere to take that from to do it. But COVID has also made it a little bit more delayed with what we've done. The Public Works Department as a whole has less staff than they did 10 years ago, and their duties have increased from 10 years ago. So we know it's not always perfect, but they do a great job with what they have to do. And they've taken on more and more responsibilities every year without additional staffing. So we think they're doing great. They're doing the best they can do. It's not always going to be perfect, but we are sort of offering a premium level of service that maybe we get there 90% of the time, and I'd take 90% of a premium service just about any day of the week. So kudos to the DPW, who's also worked every day of this pandemic. A lot of towns had their DPWs sort of just shut down and stay home and did a lot less work. We couldn't do it. We had a lot of work to do, so our DPW guys and girls were out there every day of this pandemic and continue to. Flu clinic and flu shots. Kudos to the school health department, the school nurses, and the Norwood Public Health Department for setting up flu clinics at all the schools. We think we'll end up have gotten about 150 students between all of those. So kudos to them for getting that set up. Every student, and particularly those of you with high school kids, we hear the numbers a little bit lower in the high school end. Every student needs to have a vaccination by the end of the calendar year. So if you've not gotten your flu shot, get your flu shot, get your flu shot. That is likely to be a recurring annual shot from now on. So please get your flu shot. I encourage everyone to get their flu shot. You can get a flu shot through the town's flu clinic. The number to call the health department and schedule an appointment, 781-384-9197. Those for folks 14 and older. They do it on Tuesdays from 1 to 3. You can also call your primary care doctor, get a flu shot there, and many of the pharmacies are offering flu shots as well. Joe, our producer for today's show, Joe Collins in my office, has posted the health department's flu shot information, so please get your flu shot if you haven't gotten it already, especially if you have kids in the school system. They are required to get a flu shot before the end of the year. So I believe I have covered volunteers. Circle of Hope. Just one more reminder before I get to the end of my announcements. Circle of Hope's Luminary Night has been moved to a different date and time. It's available on our social media sites. I believe it's actually going to be moved to this Saturday due to the rain, but let me confirm the actual date and time here for everyone. It has been canceled. Nope, sorry, the new date is Sunday. I misspoke. The new date is Sunday for Circle of Hope's Luminary Night from 4 to 6 at the Town Common. We encourage you all to come out and enjoy that safely if you can. Central Street will be getting picked up soon. It'll take a couple days to completely break it down. We are looking forward to returning it in the spring, probably sometime in April. We got to see how the winter goes. Same thing with outdoor dining. You'll see most places, with a couple exceptions, wrapping up their outdoor dining. We're looking forward to finding a way to bringing that back in the spring. We think it's been very popular, and certainly if you've enjoyed it, you can send us an email and let us know that you've enjoyed it. Same thing with Central Street. If you've enjoyed that, you can always send us a message and let us know, and any suggestions or thoughts you have. When those things return in the spring will really depend on what kind of a winter we have. This past year we did have a fairly mild winter, so if it was this year, it's something that could happen in April, but we know that we have those winters where it is just 2 feet of snow on the ground well into March, and it just takes a lot of time to clean up and get things in good shape. So we'll have to see how the winter goes. We're hopeful, knock on wood, for a mild winter. It's been a little wet so far since we had the October snow. It's been a little wet. We hope that's not an indication of what's to come for winter snow, but we do never know. That being said, I believe I've reached the end of my items of stuff folks have emailed in and our COVID numbers. Again, 3.8 positivity rate. climbing up there. We don't like the fact that it's climbing, but we really do hope that folks continue to be safe and the vaccine is coming. If folks have any questions, you can continue. Oh, sorry, one other item I keep forgetting. Last week somebody had asked about the status of the Norwood Fund. Prior to about late last week, I looked into it. It's down to about $28,000. So there's been a lot that's been expended out of there, as we are seeing an increase in need for food security, our veterans programs, and this time of year the utility requests do start to go up. So you can always contact us at the Citizen Information Center or managers@norwoodma.gov if you are facing any challenges, and we'll try to help you out the best that we can. That is the extent of my information. If folks have comments, they can continue to put them in the comment section. You can always email us at managers@norwoodma.gov, and we will get back to you. And I think that's it for this week's COVID update. So if there are no other questions, I do want to encourage everyone. Oh, in addition to shopping small, check out the Norwood Cultural Council's site on our page. They have a fund set up to help some artists from displaced from the Winsmith Mill. So with that, I hope everyone has a great week. I hope you stay safe. I hope you had a safe Thanksgiving, and I encourage everyone to shop small and reach out if you have any questions, problems, or concerns. Thank you, everyone.